This is Chip Means. I'm at the NCR booth at HIMSS10, and I'm about to talk to Jeffrey Kendall about the Wayfinder solution and the MediKiosk solution for hospitals.
The advent of meaningful use and the rise in the adoption of electronic medical records, one area where we're focusing on is starting the collection of that data at a self-service touch point. So whether that's online through a portal, whether that's at a kiosk, basically streamlining the intake of the health history form so that that can populate to the EMR is a much better way of collecting that data up front. The idea of writing the information down from a patient perspective onto paper and then transcribing that data is really, we think, an unfortunate circumstance if physician offices implement that way. This is our wayfinding solution, which comes in a variety of different form factors. This is obviously a large screen touch panel. It can also be deployed on a regular kiosk or to the patient online at home. But it simply allows a patient, when they come into a facility with today's complex facilities, difficult to navigate into most hospital systems, this allows the patient to easily find their way to where they need to go for their appointments and services. So simply by using the touch screen and searching for the department that they need to locate, the patient then gets a real-time map that's dynamic and is able to give them directions as to where they need to go from that particular point of service. This can also be tied into check-in, so as soon as the patient's been registered for a visit, it can automatically direct them where they need to go based on their appointment type. So the check-in experience starts with the patient selecting the language of their preference, and then there's a variety of different ways that the patient can authenticate. So they can swipe their credit card or driver's license, insurance card, scan a barcode, or our recent partnership with Fujitsu allows us to do palm vein scanning. So a patient can simply touch their hand to a palm vein scanner once they've enrolled, and it will authenticate them immediately to that day's scheduled appointments. So what will happen is to pull up the patient's information from the scheduling system, show them their visit information, they can confirm that, and then they're able to go through the typical demographics review, ordering physicians review, all the usual suspects of a check-in process in a hospital or outpatient area. One of the key areas for us for data collection is really allowing the patient to review their own information. I can spell my last name better than anybody else, so what we find with our hospitals is that bad data is reduced by allowing the patient to verify that themselves. So if I go in and I need to change my street address, I'm empowered to do that. The staff are able to review those types of changes before they're made by the patient downstream. We can also do workflows that involve scanning a person's insurance card so that we keep a double-sided image of that on file. That way the patient can review the copy of their insurance card before their visit and make sure that everything's correct. We also have workflows tied into things like real-time eligibility verification and real-time claims adjudication that actually allow the physician provider to be paid faster.
That way you're kind of putting all of that management of the information right in the hands of the patient.
That's right, and that's really where NCR's heritage comes from, is in the self-service arena. So across all different industries, we are the global leader in self-service. So in the US, we have about 15 of the 16 domestic US airlines use our self-service solutions for check-in. So now we've brought that same sort of technology into the healthcare environment to be able to streamline those processes. We talk about meaningful use of being able to review clinical data and input clinical data into the EMR. Self-service is a fantastic way to do that. The patient can go through and very simply identify what different parameters need to be reported for things like health history review of systems, so that that information can be put into the EMR and reviewed by the clinician.